Hey there, good evening. We are back with you with another live I Care for Your Brain. We are trying to get you the highest quality, evidence-based information about brain health because why? You deserve it, and there's not enough of it out there. We're going to talk about a topic that is very important tonight if you have kids in your life or grandkids in your life. And it is about the specific risk factors that impact your chances of developing all sorts of dementia in older age. Dementia is the end result of some very long processes that happen in the brain, specifically as it relates to Alzheimer's disease and a subtype of dementia called vascular dementia. And the reason we think we haven't gotten so far with cures or really effective treatments is that we think in the scientific community we are starting too late. We are only starting to treat people when, in the case of Alzheimer's, the plaques and tangles have built up for so long, over decades, that they become symptomatic and they begin to be expressed in the person in terms of short-term memory loss, word finding difficulty, personality change. By the time this is happening, we have already hit a critical mass in the brain, and then we're trying to manage brain disease to see improvement, and it's just not really happened so far. Hello, Miss Ellie. And now what the focus is for brain researchers is to really try to start much earlier in the developmental lifespan and to start managing the known risk factors that build up over time that ultimately tip that bucket over into dementia. So if you go through all the different time spans in a human life, there are very specific risk factors that start in infancy and childhood, go into young adulthood, middle adulthood, and older adulthood. All too often, we just talk about the things that happen once we turn 60, once we turn 65, and that's not really the time when we have the most power. It would be much better for public health if we talked about these things all the way back into childhood. And so we are going to try to do our best to do that tonight. So to have this conversation, we really have to have some foundation for our understanding of brain health, normal brain aging, and dementia. Because if we're just sitting here tossing around these terms and we're not all on the same page, that's not very helpful. So when we think of normal brain aging, what you should really think of is that it's a very mild process when it happens normally. And just like the body slows down, the brain slows down a little bit as we get older. The main thing that gets impacted is complex processing speed and high-level multitasking, complex planning, and rapid retrieval. All of those things you could think of as kind of the brain taking a little bit of a turn towards being slower. Our eyes also don't work as good, and our ears don't work as good. And so those, of course, are the sensory bridges. Those are the information feeders into the brain. So if they're not giving the brain the highest quality information, the brain isn't really acting on the clearest signal, and what it has to work on is kind of degraded. So those two things together, sensory health and the processing speed of the brain, that's really responsible for cases of normal brain aging. When it starts to go more abnormal is when the cognitive decline is much more than mild, and specifically it starts to impact what we call instrumental activities of daily living. This is your ability to drive to and from places safely and knowing where you're going, your ability to remember to take your medications, and most sensitive is your ability to manage money, balance a checkbook, handle investments, these kind of things. In the syndrome of dementia, we have these cognitive symptoms, but we also always have mood and behavior symptoms. So for many people, there is a certain amount of emotional flatness that can come along with dementia. A person doesn't seem like they're interested in the same things that they were before. They can become more irritable. Some subtypes of dementia have personality getting bigger, and people can become more impulsive, and their filter doesn't work as good. And there's always that functional piece, like I was saying, everyday life ability and independence goes down a little bit, and people need support in order to stay safe. So in that umbrella of dementia, there are many, many, many different subtypes. The most common ones we talk about are Alzheimer's, Parkinson's dementia, Lewy body dementia, vascular dementia from stroke. There's also quite a few treatable conditions like alcohol, medication effect, vitamin B12 deficiency, urinary tract infection that can mimic dementia. And these are the reasons that it's critical that you have a top quality clinical brain person working on you or a loved one. These are called neuropsychologists, and that is what I do. And so in terms of dementia, why do some people get it, why some people don't? It's really a combination of your genes, what you were born with, and the behaviors and lifestyle choices that you make throughout your life. So when we talk about reducing your chances of getting dementia, we have to talk about reducing the risk factors that we know turn on the dementia genes. And we also want to increase your cognitive reserve, which is basically your buffer against these brain-related changes. So, like I said, many dementias are the result of cumulative disease, wear and tear on the brain, trouble getting good blood flow to the brain. So we have to really take it back all the way to infancy and childhood. And that's what we're going to do in tonight's lecture. So in the world of genes, you know, some of the basics are, of course, it's made from DNA. You inherit 2 copies of each gene, one from each parent. They are found within almost all of our cells. And of course, these are the basic instructions that are needed to not only build our bodies, but to maintain our bodies. And one of the key things that genes do in the brain is that they are able to get in there and remove stuff, build up from the brain that shouldn't be there. And this is where Alzheimer's comes in, because Alzheimer's is the result of plaques and tangles inside the brain cells and right outside of them, that when they grow too much and the brain can't cleave them apart, chop them up into all their little pieces and get rid of them, they basically suffocate the brain cells. And this is how we have neuronal death in Alzheimer's disease. So people can have different genetic variants that make them better or not as good at removing these plaques and tangles. An unknown fact, which is very interesting, is that all of us, if we get old enough, have a certain degree of plaques and tangles in the brain. It's not abnormal to have them in the brain. What is abnormal and what becomes Alzheimer's disease is when we can't chop them up and remove them. So some of us have more genetic variants that may lead to a not so good chopping up garbage man coming in and getting rid of all that stuff. And some people have a very efficient system. So for most of us, we have kind of a genetic predisposition. Maybe there is some tendency to not get rid of the plaques and tangles, but it's something we do in our life that turns on these genes. So kind of think of your genes as like the lock, and the things we're going to talk about tonight like the key. And when you have the right key in that's what makes the dementia genes kind of come to life. Genes play a role in almost all dementias. Very few dementias are strictly genetic, and a good rule of thumb is the younger you are when you start to develop symptoms of dementia, the more likely it is to be genetic. So when you're worried about family history and your genetic likelihood of developing a dementia, one rough way you can look at your level of risk is to look at the age of onset for people who are in your family who are genetically related to you when they develop dementia. It's a much more concerning situation if a parent had early onset dementia symptoms before they were 65 than if you have a parent who was in their late 80s or 90s when they developed dementia. So the older you are when you develop it, the more likely it is to be more heavy on the lifestyle and the behavior changes. So Alzheimer's disease is the perfect example of this. So we have 2 types. We have early onset, which is before the age of 60, and that is very strongly genetic. And if you have 2 mutations, one coming from each parent for the Alzheimer's disease genes, you were going to get it no matter what you did. If you are on the other side and you have what we call late onset or sporadic Alzheimer's disease, it's probably related to something throughout the course of your life that made those genes turn on. So like I was saying before, why look at the lifespan? How are we equating childhood development and something like Alzheimer's disease or dementia that is thought to be diseases of older age? Well, like I said before, these are the end results of decades of a buildup in the different parts of the brain, different types of diseases. So we're going to take it all the way back to genetics, infancy, and childhood tonight. And we're going to go through 7 altogether. So the very first thing that can happen genetically to a child during the early stages of development that can impact dementia down the road is Down syndrome. These folks represent the largest group of people with dementia under the age of 50 years old. And this is because people with are born with an extra copy of chromosome 21, and this is the gene that carries the production gene for the protein called amyloid precursor protein, APP. And what happens in Alzheimer's disease is this APP builds up these protein clumps, and these are part of the plaques and tangles that develop in Alzheimer's. So by the time someone with Downs is 40 years old, almost all of them have these plaques and tangles in the brain. Doesn't necessarily mean they will all develop Alzheimer's disease, but we think that if people with Downs get to be about 50 or 60 years old, at least half of them will be living with clinically expressed Alzheimer's disease. The next thing that we know is related to the future development of both Alzheimer's disease and vascular dementia, which can happen after a big stroke or several smaller strokes, is maternal smoking. So if the mom smokes during the pregnancy, this raises the risk when that person is 70 and 80 years old of developing dementia. Isn't that interesting? The other thing is low birth weight. And this is probably a statistic that's actually in the midst of changing right now because we've made so many advances with NICU interventions. And so if you've had a baby or a grandbaby that is under the weight I'm about to say, please don't panic. We have made so many strides even in the last 2 to 3 years in how we manage preemies that I don't think the statistic necessarily holds as much anymore. But maybe about 5 years ago, there was a couple papers that came out showing that 6 pounds, 2 ounces seemed to be the cutoff, and that these people were more likely in middle age to have symptoms of cognitive decline. And why they thought this was is that they are much more at risk for developing cardiovascular issues in middle age because of the early issues that come from lung development not being optimal by the time they were outside of the womb. So we now know a lot more about how to keep little babies oxygenated. So we're hoping when we follow these kids long term and when they get into older adulthood, we're going to actually see less instances of dementia that we even saw 5-10 years ago. The next factor is poor school performance. So there were 2 studies in 2015 that showed an association between how kids did in school at the ages of 9 and 10 and late life dementia. And so they looked at kids who in 4th and 5th grade had the lowest tier of school grades, and they were 20% more likely to develop dementia in their 60s and 70s. And when you follow these people to the age of 75, about 50% of them who did the worst in school, in elementary school, they had about a 50% greater risk of having dementia. People who complete secondary school, so this in the United States is 9 to 12, have a 28% lower risk of developing dementia compared to people who only complete elementary school. So I want you to put on your critical thinking caps when you think about this research though, because remember, I did not say cause and effect, I said association. So all that means are that those 2 variables travel together, right? So poor school performance and late life dementia. What are some of the things in between there that we think might have actually had the influence to affect future brain health? Well, I mean, you could think of things like maybe kids who don't do well in school don't have the best nutrition. I mean, we know so much now about the importance of breakfast, for example. So if you are living in poverty, you might not have the opportunity to have breakfast, and maybe this is why you don't do well in school. You could be being traumatized while you're a child, and you might not be able to focus in school. And we know that trauma actually has a direct impact on the central nervous system. We know that kids who don't get excellent medical care because they maybe don't have health insurance, they miss more days of school with things like upper respiratory infections. Maybe that's why they're not doing great in school. So that piece of data isn't super compelling, but it does tell us that we need to be watchful of kids who aren't doing great in school, because not only might they be going through something now, but there is a future health implication in the future. The next one is something specific within the academic world, and this is dyslexia, a verbally based learning disorder. The genes that are associated with dyslexia are associated with greater damage in language-related regions in the brain. When you take folks who have language-specific types of dementia, so this is things like frontotemporal dementia or primary progressive aphasia, and you do their histories, More often than is normal in a non-demented population, these people have a history of dyslexia, difficulty with spelling, difficulty with reading. And so what we think it is that over time, there are probably genes that are connected to both dyslexia and frontal lobe-based dementias that result in a increased risk factor in those people. So people who have something like primary progressive aphasia, like I said, not only do they have the history of having dyslexia, but if you scan them in an MRI scanner, they actually have thinner brain matter, specifically in that language area, more so than someone who didn't have dyslexia. So you can have two groups, both have primary progressive aphasia. One of the groups had dyslexia. They both have similar symptoms, but one actually has a thinner language part of the brain, which suggests maybe there was some long-term influence from the dyslexia. This finding has also been found in what we call pre-literate children who we know have a first-degree relative in dyslexia. So they haven't even necessarily started to really read yet, but we're also seeing that that language part of the brain is a little bit thinner. So there's something about those language-based learning issues that can kind of carry you throughout life. Now, it doesn't mean, of course, if you or your grandchild has dyslexia that you're necessarily going to develop dementia. It just means that statistically, there is a greater likelihood that you will if you have that disorder. The next one makes a lot of sense to me. It is socioeconomic status. So we know that kids who are raised in poverty have a much higher rate of all sorts of things in the aging process. They have higher likelihood of having heart attacks, in having stroke, in smoking cigarettes and drinking too much alcohol. Stress has been a huge focus in the neuroscience community, thank God, in the last 10 years. And we know that childhood trauma, which can either come from not having enough money, from having parental conflict, to having a disability, there's a lot of different things that can cause chronic stress hormones to be released in the brain. These things have very far-reaching implications. And so one study was very interesting where they looked at kids who were being raised in a military context, and this is very relevant for me here in North Carolina, as we have the Special Forces hub here very close to my office at Fort Bragg. And what they looked at, this was just last year, was children who were raised on military bases, and even though they were technically low socioeconomic status, they had programs that were built in that made sure they had breakfast every day, that made sure they had tutoring if they need it. And what they found in the study was that the impact of being poor could be offset if people were able to get these supportive programs early on in their cognitive development. So that really speaks to the need for having more outreach, of course, to children who are of lower socioeconomic status. And the next two go hand in hand. It's low physical activity and high television viewing. So this is a study that was 3 years old now, looked at children in mid-childhood, so about 10 years old, who had low levels of physical activity, watched a lot of TV, and I'm going to define those for you in a minute. They were almost 2 times more likely to have poor cognitive functioning in their 50s. And this is after you took out the impact of smoking, alcohol, high BMI, and high blood pressure, which all of those things have a lot of influence on brain health. So the way they define low physical activity was if less than 3 times per week the child was moving their body for 50 minutes at a time. And high television viewing was if they watched TV for more than 4 hours a day. And I was kind of surprised at those numbers because I don't necessarily think that is shocking, or that's considered to most people to be relatively excessive. Now, of course, they also looked at TV. I think there's plenty of kids who are not watching TV anymore, but are looking at their phone. So it will be curious to see future research being focused on other technologies, but probably it has the same effect, right? So what's important to know about this information is its application, right? It means nothing if it just stays with us as a point of interest. We have to take this information and talk about it and apply it and use it as motivation to help children and their parents develop better habits, because ultimately we are trying to reduce the public health crisis of dementia. So I hope that you take this information and you share this video, and maybe you use it as an opportunity to have a conversation with someone in your life to say, you know, these things aren't just important now, but this is something that might come back to hurt this person in the future. So I appreciate so much being with you tonight. I'm going to be back in 2 weeks, and I'm actually going to take on a pretty big topic that I have been wanting to research for some time, and it just keeps coming up over and over again, and I really haven't had the time to sit down and get to it, but I will for our next meeting. And this is menopause and memory. This is an area that has not gotten a lot of research until very recently. I have plenty of middle-aged women coming into our clinic saying, I don't know what's going on with me, but ever since I started to go down this path in life, I feel like I'm foggy, I can't concentrate, I'm having irritability. I think there's a lot going on here. Last time I looked into it was about 5 years ago, and there really wasn't that much research, but a quick lit search 2 nights ago got me enthusiastic, and I thought, wow, if I could really spend some time working on this, I bet this could be a really cool Facebook Live lecture. So that is my commitment to you. We will meet again here 2 weeks from tonight, and I will do a longer and more in-depth lecture for you. Like I said, thank you guys so much for being here. It's super rewarding to me to see your comments and to know that this information makes you feel more empowered and more educated. That is what it's all about. So thank you guys so much, and I'll see you in 2 weeks. Bye-bye.